How are African American families advocating for Alzheimer's support? Imagine a community coming together to make a difference in how they care for their elders. That's exactly what many African American families are doing to support those affected by Alzheimer's disease. They are taking active steps to raise awareness and improve access to help. Because African Americans are about twice as likely to develop Alzheimer's compared to older white adults, their efforts are especially important. Families are forming local groups that work with churches, health agencies, and volunteers to share information about the disease. These groups organize support meetings, provide respite care, and help caregivers find resources that respect their cultural values. Faith-based organizations play a big role in this advocacy. Churches host special events like Memory Sunday, where they talk openly about dementia, reduce stigma, and connect families with services. These gatherings often include health screenings and educational talks, making it easier for families to understand early signs and get help sooner. Many families also educate themselves and others through workshops and tailored materials that focus on the specific needs of African American caregivers. This knowledge helps families recognize symptoms early and seek timely medical advice. Volunteering is another key part of their efforts. Caregivers and community members volunteer as educators, event organizers, and policy advocates. They work to influence local policies to improve healthcare access and fight racial disparities in diagnosis and treatment. Some groups focus on addressing social injustices that make it harder for African Americans to get proper care. They push for more equitable healthcare services and create community chapters to support seniors living with dementia outside of hospitals or nursing homes. Organizations like the African American Alzheimer's and Wellness Association and African American Dementia Care Networks are dedicated to providing culturally relevant support. These groups offer programs that help caregivers manage stress and navigate the challenges of Alzheimer's. Many families also partner with medical institutions and community organizations to expand outreach and resources. These collaborations help spread awareness and make it easier for families to find help when they need it most. Practical steps include setting up local support groups specifically for African American caregivers, hosting educational sessions in churches and community centers, and creating respite programs that understand cultural caregiving norms. They also encourage early screening through trusted community channels and promote volunteer opportunities that connect younger and older generations. Advocacy efforts aim to influence policies that address healthcare disparities and ensure better access to diagnosis, treatment, and support services. All these efforts show how African American families are actively working to create a stronger, more supportive environment for their loved ones. They are breaking down barriers, reducing stigma, and making sure that help is accessible and respectful of their cultural traditions. Their work is vital in building a community where everyone affected by Alzheimer's can find understanding, care, and hope.